Nigeria has held a sensitization walk to mark the World Tuberculosis Day. Health experts at the walk called for continuous enlightenment of the public on the dangers of tuberculosis and treatment being made available by government. They also called on the public to focus more on tuberculosis prevention by keenly observing the signs and symptoms of the ailment.
Tuberculosis is a disease that is caused by a germ called Mycobacterial tuberculosis, and is actually an airborne disease. So it is passed from one person to the other. It is passed from an infected person to the other when the person sneezes or cough or also shouts. So the droplets, the Mycobacterium tuberculosis nucleus gets into the air and hangs there, and so another person coming by could actually breathe in such nucleus, and it will start developing the disease in the lungs. We also have issues, cases of childhood TB, and that is also one of the challenges we are facing, because the notification is quite low. The benchmark for childhood TB in Nigeria that the WHO had given is that we should have 12% of the population that have tuberculosis, but we are only having just 6% as at now. So it's a big challenge. People don't really get to know that the disease is there. And then the symptoms, they don't know. People could be having cough or losing weight, or a mother can be having a child that is not thriving, is not growing, is losing weight, is fatigue and all that, and maybe having cough too. And rather than taking that child for a test, they might be giving the person other things that might not necessarily cure the child of tuberculosis. Another thing is also the stigmatization and discrimination in the community, because in the community people look at tuberculosis as being a cause either from God or as a result of the sin committed. So even when somebody gets tuberculosis, the person will rather hide rather than going out to seek for help in the right places.
We need to continue to enlighten the people, because we found out that TB still remains a problem. Even after the fact that it has been an old disease, it still seems that the social stigma and the myths around TB still encourages the general populace of not even recognizing the symptoms and signs, and that this disease is curable. Very many people still believe that the disease is not curable, and this is why a lot of people have little knowledge of TB. The national program did a survey some time ago, and it showed that the knowledge of people in the country is still low about TB. Only about 30-something% of people have knowledge of TB in the general population in the country. So this is the reason why we have to continue to reinforce educating the general populace about TB, so they know the signs and symptoms, and that the government at all levels have provided treatment facilities for them, which the diagnosis is free, the treatment is free in most of the DOTS facilities that are in the country. We have primary care centers in the country all over the states. We have secondary health care. We have in all tertiary institutions in the country, and very many private hospitals, the private PPM that we are doing in the country. So the government has been able to articulate partners and other people to ensure that the national program is able to run TB services. There are plans now to ensure that the ACSM units are able to ensure that we have a year-long activities on enlightening the people. And secondly, the national program has a community TB aspect, where we have engaged the community-based organizations who are conducting active case search in 12 states currently, which we are planning to expand. The based organizations now conduct outreaches throughout the year going from community to community, doing house to house case search for TB. So we expect that with all this, we will be able to ensure that throughout the year we are able to enlighten the people. It might not be at the magnitude of what we are having this week, but it will be something to sustain the enlightenment of the general populace.
Our target is to end tuberculosis in Nigeria. Our target to ensure that no person should die of tuberculosis. Our target is to ensure that none of our children should die of tuberculosis. Our target is to ensure that no one is left behind in our struggle towards kicking out tuberculosis and other infectious diseases in Nigeria.
Okay.
Nigerians should have a healthy life, because with healthy life, we are on a sure way towards development and empowerment of the populace. The cartridges are sold in the markets. If you have the money, you get cartridges. If you have the money and a good leadership, you get the cartridges and use them judiciously. If you plan very well, you get the good number and the good quantity of cartridges you use. However, it is not only gene expert that we can use in diagnosing tuberculosis. But the fact is that gene expert, has a dual purpose of detecting tuberculosis and also drug-resistant tuberculosis. So what we have come up as a national program is to get the ones that are also sensitive in picking tuberculosis. They may not be sensitive in picking the drug-resistant. So we use those ones, as a screening device. Because that one we use it to screen a large number of people. That will reduce the number of people that will be positive will now go for gene experts. So that's the strategy because of the cost implications of getting the cartridges for gene expert. And also gene expert is very sensitive. Power, expertise, and others. So we have other ones, the TB lamp, the true nut that can survive, in harsh, temperature and others. That you can even, the power may not be too demanding. So you can use those ones to screen large number of people to reduce the number of people that will now be subjected to gene experts. Now, we have also engaged the private sectors. In fact, Nigeria is one of the countries that did very well in case detection for tuberculosis, even in the midst of COVID-19. How are we able to do that? We're able to do that with engagement of the private sector. In fact, at that time, I think they gave us 25% of the TB cases came from the private sector. And we're also scaling up. If you look at our data last year, private sector has improved. But we want to expand more. Private sector includes the healthcare facilities, the community pharmacies, the private medicine vendors. All of them are inclusive. All of them are inclusive. Don't forget that it is not all just the money. We need good leadership. We need people having the passion. We must bring every person on board. The civil society, the academia, the researchers, even the media. We need every person because I don't know how much I can pay you to be under the sun. But if you have the passion, you will be here and lend your own voice in kicking out tuberculosis in the country. There should be, actual, a normal procedure in calling for task force. But the fact is that Nigeria is sitting on a keg of gunpowder in terms of tuberculosis burden in the country. Nigeria is number 1 in Africa and number 6 in the whole world. And we are not comfortable with that. So if you arrest tuberculosis in Nigeria, you have done half of the burden in Africa. That's what that statement means.